Welcome to the Down There Where podcast. I'm Amy Milne. This is the show where we get loud about women's below-the-belt health from menstruation to menopause and everything in between. So many women continue to silently endure issues like endometriosis, PCOS, menstrual disorders, and menopause-related challenges without the proper support. We're done with the whispers. We're here to break the taboos, share the stories, and have the conversations no matter how uncomfortable. Whether you're dealing with your own health journey, supporting someone who is, or just ready to join the movement, you're in the right place. Let's get loud. 96% of medical schools in North America have zero compulsory education in pain. Zero. So when women with endometriosis walk into a doctor's office in agony and walk out being told it's normal, now you know why. My guest today was one of those women. Jill Mueller is a physiotherapist with over 20 years of experience, and she'll tell you she didn't choose this work. It called to her. She came to it because she was dismissed by the system, by her doctors, even by her own father, a physician, who told her that her period pain was normal. It wasn't. Jill had endometriosis. She went through the fertility journey, the wrong surgery, the years of unexplained pain. And instead of accepting that as her story, she went digging. And what she found changed everything for herself and for every woman who came after her. She's the founding physiotherapist of Endometriosis 360, an interdisciplinary and virtual program combining psychology, dietetics, and physiotherapy to treat the whole person, not just the diagnosis. And she's here today to pull back the curtain on everything the system never told you. This is the Down There Aware podcast. I'm Amy Milne. Let's get loud. Hey, Jill, I'm so excited to have you on the show today. Welcome.
Thank you, Amy. I'm so excited to chat.
I am, well, we have so many, we chatted before we said let's go, and we have so many connections and places and reasons for us to meet. And I know a little bit about you, but our audience doesn't. So who are you, Jill?
Oh my gosh, that's such a broad question, but
I love it. Fill in all the blanks.
I'll keep it towards what we're sort of chatting about today.
Yeah.
I am a person who ended up growing up with endo. I didn't know that I had endometriosis until I was trying to get pregnant. And that was even further along into that journey where one of my fertility gynecologists said, I suspect you have endo. And people have to understand, this is before ChatGPT. This is before sort of the internet, Google, like I couldn't Google it. I was so focused on endo or on getting pregnant that I was like, okay, whatever that is. And then she did a laparoscopy, diagnosed me with it. But the problem was she was not properly trained, and we can get into that. So she did what we call ablation surgery versus excision surgery. We can get into that. It did nothing for my pain. It did nothing for my fertility. I didn't get pregnant for another 4 years after that. But it was when so I'm a physiotherapist, and I sort of segued into pelvic physio after my journey with fertility to help people with fertility and to help people with pelvic issues. But endo still wasn't on my mind.
Interesting.
And so I took a pain science course and realized, oh my gosh, am I somebody with persistent, like chronic pain? I did not identify as somebody with chronic pain because it was cyclical. But then there are certain strategies, and I filled out these questionnaires and I was like, okay, this is a component of it, and addressed the strategies based on those targets that were contributing to my pain. And I was able to get out of my pain entirely.
Wow. I just like full body chills on that. That's crazy.
Yeah. So now that's not going to be everybody's story.
Right.
But the longer we have pain, and also I took a trauma course for my patients, again, thinking it was something I would educate myself about before my patients, and then realized I was somebody who went through medical trauma. I was dismissed by many doctors, including my dad, who was a doctor, who said that
Wow.
pelvic period pain was normal. So that's what he learned. That's what I
Mhm.
heard. That's what, you know, I kind of saw in my daily life with my friends who had
Right.
it. It was like, no, 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 that's normal. And
Right.
so I think when you get dismissed and invalidated along the way, that can add to this sensitization of your nervous system. It can add to worry thoughts. It can add to distress. Absolutely. But targeting all those are really also an important component. And so my learning and doing me search was
Mhm.
huge to my passion and kind of being, I don't want to say dragged, but like this is your route. You should go into
Right.
helping people with endometriosis and pelvic pain. So that was sort of my direction professionally into this route.
It's like you were called, like, I mean, the pull is that calling, like, the fact that you
Yeah.
were able to take that you were called to help yourself and then to ultimately help others is pretty unique.
Yeah.
And so you're a physiotherapist first
Yep.
and now and, it's
And
what's in
still.
and still, sorry, yes,
Yes.
still and all those things. Um,
Yeah.
what I just recently no one had told me, and I had no idea that pelvic physiotherapy was covered under benefits. I always thought it was an extra cost,
Separate.
and so
Yeah.
I stayed away from it, and I just started seeing one, and I've lived in chronic pain my whole entire life, and, I mean, since my hysterectomy, the pain is it's it's a different trauma that my body's gone through,
Yeah.
um, but I had no idea that you could go to a pelvic physio and that was
Yeah.
covered.
So I think that's a good point to highlight because people also don't necessarily want to see pelvic physio on their receipt.
Mm,
The pelvic physio is not, we don't specialize. We may say pelvic physio mostly for a marketing s- strategy, for lack of a better
okay.
word, to let people know that we treat the pelvis. We have extra training in being able to assess the pelvic floor in and that sort of thing, and the knowledge actually is a lot more in depth in this area because we don't learn it in our traditional schooling. So you have to take
Okay.
extra courses, and it's also a standardized act. So there are certain acts that we have to our college needs to know that we do because they're a little higher risk.
'Kay.
And so it's kind of a monitored, it's it's a specialty without being allowed to say that we're a specialty, but it
'Kay.
is, we are physiotherapists. It will be billed under physiotherapy in
Okay.
the province of the person who is licensed in that province.
Cool. I think for anyone listening, I'm hoping people get that because I wish I had known that I could go to a physiotherapist to deal like, I'm dealing with pain that's likely sitting in my nervous system. You would know about more about this than I do, but, like, I don't have pain anymore because I don't have a uterus anymore and ovaries, and, I mean, maybe there's endo floating in my body, I'm not sure, but it's wild where I'm still carrying pain that's likely sitting in my nervous system or in, like, memory receptors or whatever the, like, real
Yeah.
language is. It's
I mean,
crazy.
we don't, our body and mind don't compartmentalize.
Mhm.
Our system is set up to compartmentalize us and
Mm,
silo us into, okay, if it has to do with your uterus, you go to a gynecologist. If it has to do with your
right,
bladder, you go to a urologist. But if it has to do with your colon or digestion, you might go to a GI doc. Like
right.
and then like if there's any psychosocial factors, you might have to see a mental health worker. But we're way more complex than that, and that's what I
Mhm.
love about physiotherapy because we have, within our scope of practice, we can take what we call a biopsychosocial approach. Now,
Cool.
our direction is not going to be only on the mental health part, but we can look at any behaviors that might be contributing to depression or anxiety. So, for
Mm,
example, if somebody has depression, movement and walking and yoga actually have more efficacy to help depression, moderate depression, than meds. Now,
mm.
if you need to be on meds, I'm
Right.
not anti-medical.
100%. Yep.
like, let's put out the fires if the fires are high. In fact,
Mhm.
sometimes I'm almost like giving people permission to do that, and then we can build up a foundation so that when they wean off those meds, they have a foundation to
Right.
land on. That's how I explain it, so that
Mhm.
I'm working with the medication, whether that be hormonal medication or medications for depression or
Mhm.
anxiety or whatever. It's like, let's just dampen the fires so that
Mhm.
you have the capacity to, and we can build a foundation,
Right.
right? But yes, we are positioned well to be able to look at the local factors of endometriosis in the sense of we can't get rid of endo, but maybe we can get things moving better, the pelvic floor, if it's tight and contributing to this discomfort. It's like, well, let's see if changing that sensation. Most people don't know about the pelvis. I have to
Mhm.
say, we do
Yeah.
not do a good job of learning about it, including in my physio school. We kind of learned about it, I guess, but I was like, la 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 la, like who goes into this line of work? Pelvic physio wasn't even really a thing back then. I'm dating myself now,
Yeah.
but
It's alright. We're
but
together at the same age and stage. It's
yeah,
perfect.
like, honestly, if people understand their body better, especially that area that they feel so out of control or the control has been taken away from them,
Mhm.
if we can educate them about it, get them connected to that area, it's amazing how much emotionally they feel better,
Mm.
physically they feel better, and they feel more hopeful in going forward and working towards their goals. So that's a big part of physiotherapy, and if it isn't, it should be.
Right, right. Yeah, and so I wanna jump into the endo piece, but I also just for the amazing listener who's listening who doesn't necessarily have, endo, but might have some pain or be more interested, can you touch on just why you would go to see a pelvic like, what you shared some of the benefits, but what can seeing you for pelvic health do for the average person?
I just spoke with some GPs and I was like, I am here to dispel the myth that all we do is teach Kegels because that and right away they were like piped up and listened, right? Because that is what I think we are grossly underutilized. Like
Agreed.
massively, massively underutilized. And we're too freaking humble to stand up. I mean,
Mhm.
clearly I'm not. I'm here
No.
today with you,
Yep.
but I'll take it for the team. I almost envision myself standing on a squatty potty as my soapbox.
Love
And
it.
I know,
Yes.
right? Maybe with some
Yes.
underwear on to represent you.
Done. We can make that happen.
Yeah. So that's my TED talk.
Love it.
On a squatty potty, but so I see mostly people who have had trauma, pelvic pain, um, endometriosis, mostly pain related and trauma related. And when
Okay.
I say trauma, that does not necessarily mean sexual abuse or something like that. It could be emotional trauma, but it's presenting itself as like the pelvic floor, those muscles are like soldiers. They do what they're told, and they did a
Mm.
study where they put electrodes or to monitor contraction in the pelvic floor. They put electrodes on their heart to measure heart rate and then measure blinking rate and showed them a scary scene on a movie. And the first thing that responded was the pelvic floor.
Whoa.
It's
That's
very
wild.
It's very responsive to stressors. So if you think of a
Mm.
dog that's scared, it tucks its tail. So what I'm trying to find
Mm.
out with someone is their tail tucked all day? And the
Great
way it would
question. Right.
present potentially is tailbone pain, chronic low back and hip pain that is not responding to traditional physio. Because another research
Mhm.
study showed that 94% of people with chronic hip pain and back pain had pelvic floor involvement. So then we're
Mm.
looking at urinary leakage because you
Mhm.
can have a pelvic floor that's too tight and then you increase the demand on it, and that's when you lose control. So it may not be weak, and honestly, we're from Southern if in Southern Ontario, we're
Yep.
all so type A and upregulated. Maybe not as much in Collingwood as where
Right.
I live,
Yeah.
but, that is the thing. You have to look at how stressed is my life because that's probably gonna be more on the hypertonic or tight side of things. Now, you
Mm,
can have a tight pelvic floor and no issues. So I don't want
right.
people to think, "I have a tight pelvic floor, I have to get it fixed." That's not the case,
Okay.
and research shows that. So I'm putting a bunch of things together: their lifestyle, their symptoms, their findings, their, tone, yes,
Mhm.
but also more tenderness on palpation. So
Mm.
if I'm doing an internal vaginal exam, which
Mhm.
we're if people don't know what we're allowed to do, that or a rectal exam
Mhm.
to test the pelvic floor, if it has high tenderness, plus one thing I want, if there's any pelvic physios listening to this, I want you to start to test, can the person tell where you are? On the right, on the left? Am I up?
Mm.
Am I out? Am I down? Because a lot of us disconnect from our pelvis when it's giving us, and this goes into
Wow.
a hysterectomy because I have some patients, and this will be a thing, where they have had a hysterectomy, so their uterus removed, and they're still getting cyclical cramping, and they're confused because they're like, that organ isn't there.
Mhm.
So that is on the neuroscience side of things. It can still happen with organs, which gets
Mhm.
really confusing, but I would say just check where it is. So that is so then we're teaching them to connect to the pelvis, the pelvic floors, because then they can actually tell, when is it relaxed, when is it tight, like how does it function. So there's a
Mhm.
lot of learning in that meeting with someone. Now,
Mhm.
what people are probably more traditionally used to is leaking with sneezing,
Mhm.
coughing, maybe urinary urgency, so that
Mm.
feeling just comes on right away. That is often tied into a heightened nervous system, or it's a
Mm.
conditioned response. Like people put the key in the door, see if there's a trigger. Like every time I hear water running, or every time I pull into my driveway, I feel like I have to pee. That is one of the easiest things. Do not hesitate to go to a pelvic physio
Wow.
for that. You could almost, like, if you don't want an internal, there's a lot of like education we can do. And that, if it's just that, that can change pretty quick. But we
Wow.
treat digestive issues, and we
Wow.
treat, constipation, diarrhea. I mean, can you see where I'm going with this? Like, it
Yeah.
is just like all functions there, sexual,
Mhm.
pain with intercourse, pain with
Mhm.
climax, anorgasmia, like can't, or that's often like not connected.
Mhm.
So the sky's the limit, honestly. Anything pelvic, digestive, orthopedic in that area that isn't really responding to traditional physiotherapy. I would encourage people to go to somebody and they will help figure it out.
Right, right. I think I like based on everything that I've done even for myself, I'm like, I think every woman should just go and should go and see someone like you because to your point, there may or may not there's things we don't know. We're not like we don't know. So to even go and be told you're fine,
Mhm.
great. But
Yeah.
if there's a slight bit of something that can be changed, like when I first met my physio pelvic floor or just a couple weeks about a month or so ago, I found her up here and just she was like watching how I walk and how I sit and like my
Mhm.
hips and it's been life changing in terms of what do I need to do for myself and where the pain was sitting and it's like it's this middle of our body that we just ignore.
Yeah. Yeah.
Like, I'm watching girlfriends right now who can't I mean, some we still dance and jump up and down, and I've got friends who can't because they're standing there with their legs crossed because they're going to pee, and I'm like, "So go see someone." I have, like, this much tolerance for people who won't get help,
Yeah.
especially when they've got friends who are educated in it and go like, "Here you go." But
Yeah.
it's it's there for us to get the help and, part of having these conversations is to for more people to hear it and listen and so to, like, fill up people's, agendas so they get the help. Um
And that can be like, they might be fine
Mhm.
with leaking, like, they don't
Mm.
leak, And then they have like hormonal changes start to happen. So they start to go into perimenopause, which can happen anytime, honestly, 34, 36. It's a journey. It is not
Right.
this one day. And then afterwards, like the one day of 12 months without a period. I mean, she's a journey.
Yeah.
And so if
Yep.
if we start to notice those hormone those were my first symptoms were urinary urgency, leaking, and
Interesting.
frequency of urination, and that was related to my estrogen dropping.
No
So I went on
way.
vaginal estrogen, and that changed everything. So these are little things we can't
Interesting.
prescribe, but
Right.
doctors still are thinking about this vaginal estrogen for older people or postmenopausal. And it doesn't absorb systemically. It's a
Mm.
localized.
No, they don't. I mean, how
It's
much do
annoying.
doctors not tell us? And this is why, creating this, like, as you are as well, creating in a bunch of people. I can't say the word right now.
Interdisciplinary
There we go. Teamwork. Every day's a
or
game of charades. Yeah,
multidisciplinary, yeah.
because, like, to your point, I mean, I know that when I was being treated for endo, and this would likely have been the same for you, it's like I saw my gyno and they did the laparoscopy, and then they were concerned it was on my bowels, so then I went and saw a different person, and then I went and saw a different person, and none of those people spoke.
Yeah,
And so I just went,
that's
"I don't
important.
know what you did inside my
Yeah,
body, like, I'm not sure. I'm still in pain, so whatever you did didn't fucking work,
yeah,
but here we are."
yeah.
Um so, one, I just think everybody needs to go see their pelvic health physiotherapist. That's like literally,
Mhm.
I'm want to wear a t-shirt, and not that it says this, but
You
like
should,
says
I like
literally
it.
go. Um, and then I want to jump into the side of the work that you're doing in endo, because I think for anyone listening, it could be life changing, because we for those of us who've had endo, and those especially still today,
Mhm.
feel like there's nowhere they can go. They're on waiting lists forever. They're waiting for that superstar gyno. They're waiting for, I don't know what to happen, and nor do
Yeah,
they. And yet
it's
there's
a
people like you.
helpless feeling.
It's
Mhm,
it's so gross. It's
mhm,
so gross.
mhm.
And, then we've got our friends who are on the side of perimenopause and menopause. But for the work you're doing in endo right now, please share.
So again, like I was kinda dragged into this,
Yeah.
not dragged, but like
Pulled. We're going with pulled.
summoned?
Yes,
Summoned?
I
I don't
like
know the
it.
word.
Summoned is good. Yeah.
Um, so I dove into like the research on it, and I know some of the people who are doing, where they're doing a lot of great research out in BC. In BC
Mm.
Women's Health, they're doing amazing, amazing research out
Ooh.
there, looking at the whole person. We need
Oh,
to
what
look
a
at the whole
concept.
person. I know, right? Weird.
What a concept.
But a lot of the research I also look into is the research on pain. So here's a sad stat. 96% of medical schools have zero compulsory education in pain in North America for doctors. So I
Mm,
know.
that doesn't even
What?
make sense.
I know. So this is why they're not great at treating chronic symptoms and
Interesting.
persistent pain because
Okay.
and then if they do know a little bit about it, which I have seen a shift,
Mhm.
some doctors know about this thing called central sensitization or nervous system sensitization, pain system sensitivity is what we're calling it now.
'Kay.
They know a bit about it. They know it's a thing. They can tell that that's contributing, but they're not given the opportunity to explain it. So we have 7 minutes with these doctors. The
Right.
system's not set up for them to be able to explain it,
No.
unfortunately. So then it's like, well, why not hire a nurse or someone or even a Joe Schmo to educate them on how to do it and educate the patient on it? Like something needs to happen.
Yeah.
But
Agreed.
what happens is the people will leave their medical appointment feeling like they said it's all in their head.
Mhm.
And maybe sometimes they are literally saying it's all in your head.
Yeah, that's the thing.
But even if you're left coming out of that appointment feeling like they said it's all in your head, there is like some connection of information, some transference problem there,
Mhm.
right? Now, I went into the pain neuroscience studies and research because it's freaking fascinating
Mhm.
and it's so underutilized. So
Mhm.
I'm looking at conditioned responses. Like our brain and our nervous system, I want people to realize our brain and our nervous system are doing what they need to do in order to protect us. They are
Right.
doing what it thinks it should be doing. So it's not fighting us. It's presenting as pain, but there's no such thing as like pain because of, well, this is where I'm gonna probably get, you're gonna be like getting some
No, I love it.
pain. Yeah. Bring on the comments because this
Totally.
is a conversation that needs to
Yep.
happen. So here's the thing that made me curious about this. There are people with a lot of endometriosis and no pain.
Mhm.
And I said, how do I become one of them? Because I had
Mm.
surgery, it did nothing. I did it sort of experimentally with myself,
Right.
and then things changed, and now I'm not saying not everybody needs surgery. There definitely are people who surgery is a good option
Mhm.
for them, but there are certainly we can actually assess ahead of time who's at risk of coming out of surgery and still having pain.
Interesting. Wow.
Yeah. And that study was done by Natasha Orr out in BC Women's Health.
Mm.
So we can predict who's at risk through 2 questionnaires.
Hmm.
Now, I use those questionnaires. I
Mhm.
use them also to say, okay, let's optimize your system so that your recovery is better after surgery. And this is where we have the blessing, I'm doing air quotes if you're
Mhm.
just listening to the podcast,
Mhm.
the blessing of the long wait for the surgery
Right.
is that don't wait. This is my message because a lot of people are like, let me get the surgery first.
Right.
Don't wait
Right.
to get assessed. Now, not all pelvic physios are assessing this. If you're a pelvic physio listening to this, you need to do the central sensitization inventory and the pain catastrophizing scale. Don't get thrown off by that
Name?
word. I hate that word. I never
Yeah.
use it with my patients.
Yeah.
But it's when we get stuck in a worry cycle,
Mhm. 'Kay.
a pain worry cycle, right? We have our period coming up. We're anxious about it coming up.
Oh, for
Listen,
sure.
no fault of your own. This is what our
Nope.
brain's designed to do. It's designed
Mhm.
to protect us, and it thinks it's like protecting us through being anxious. But ironically, that's a danger message going in, and pain will be a worse output. So let
Right.
somebody help you know how to change those things. So those are 2 things that I check,
Mhm.
that pain system sensitivity, which was my thing,
Mhm.
if you're stuck in a pain worry cycle, but I also look at any conditioned responses. So we
Mm.
usually have a routine around our period or around our pain or around our flare ups. So let's say somebody has a period, they have their period coming up, they're like anxious about it, they cancel all their plans, they get out their hot pack, they get their Netflix ready, and
Mhm.
they lie down on the couch. Listen, I am not shaming you for that
Nope.
at all. But it's like it can be like a Pavlovian response where the brain, like Pavlov's dog, where
Mhm.
Pavlov rung the bell and fed the dog, rung the bell, fed the dog. And eventually, the ringing of the bell, the dog was anticipating food and would start to salivate. So
Right.
that pain during a period could be a conditioned response to, for example, the hot pack. So I had a patient who
Mm.
didn't have her period at the time. And I said, I want you to just think about putting your hot pack on your lower abdomen. And she did. And she was like, well, I'm starting to cramp. And I was like, okay, so that's how we know this is a bit of a conditioned
Right.
response. And then in the antidote to that is sort of just changing up the routine. Maybe instead of just the hot pack, I might have them use a TENS machine on their low back
Mhm.
because it's almost like in the beginning you're keeping the safety and the security of having the hot
Mhm.
pack, but so you're ringing the bell, but you're also like honking a horn, and the
Right.
dog's like kind of
Mm.
confused because we're trying to change that conditioned response
Right.
of pain being an output. So that's the
Mm.
third thing. The other thing is when I check internally, I'm like, can you tell where I am? Because if we've disconnected from our abdomen and our pelvis, the brain is not going to know if it's holding tension
Mm.
or it doesn't know how to relax. It's like and then it will have a bigger protective buffer zone around it because it doesn't have accuracy. So this is
Mm.
when intercourse can be painful. Maybe people have anorgasmia or a lack of sensation, a lack of feeling, a lack of
Mhm.
like excitement down there. They leak, but their pelvic floor may seem strong. This can be
Mhm.
confusing for people. Pelvic physios, it can be confusing. So then I use a remapping technique for that. And then the other thing is I look at the local factors. So any mobility, fascial mobility issues.
Mm.
And I think I'm not fixing adhesions. I'm not
Right.
getting rid of endo or anything like that. I think from a neuroscience standpoint, what I propose to do in a non-threatening way, we need to be non-threatening, especially
Mhm.
in a system that's sensitive. If I'm mobilizing something and giving you a different sensation, does that alleviate the anxiety?
Mm.
And that gives us something to build on. I'm not
Right.
fixing, but can we give it a different experience so that now when you walk, you can walk with more freedom, it
Mm.
feels different, you can walk further, you can do more, and then that just kind of is the catalyst to getting progression. So
Right.
not everybody looks at all of those, but
Right.
those are the patterns. I treat mostly people with endometriosis. Those are sort of the patterns that I've noticed, and I don't silo again. I'm
Right.
looking at what are the contributing factors, the quote unquote opportunities to
Mhm.
make change, and where do you want to start?
Right.
Right?
And
Yeah.
it's just even starting and exploring because there's, like you said, that blessing of waiting for surgery, which could be forever. I'm sure you have a wait list. However, I'm sure it's not a year and a half. I mean, it's a good problem to have, but not because then we know what's happening, right? But it's like there are things that we are not told at all that we could be doing to help ourselves. Like I think of, when you talk about like my whole nervous system, when you even just talk about um waiting for your period and knowing what's gonna come, like, I just knew I was gonna be devastated
Yeah.
and in pain, and my brain wasn't gonna work properly, and I was gonna hate the world, and I like, all those things, and it
Mm.
takes deconditioning, like, even for myself after my hysterectomy, I didn't necessarily always have pain around my periods necessarily, but it took a long time for me to realize I wasn't in pain monthly.
Yeah.
Like, it was a
It was a
wild
bit of that
experience.
conditioned, right?
Mhm.
Like, you were like, you could probably, even subconsciously at
Oh, yeah.
times, notice there was a little heightened anxiety, and
100%.
if you could track it, it probably was a little bit at that time.
Yep.
It's amazing what our nervous system and our brain
Mhm.
can do to predict and protect us.
Yep.
But it can continue the process of discomfort, even if it's like mind changed from pain to a little more on the anxiety side,
Mhm.
but it's the same treatment in terms of, like, managing the nervous system. But it's a wild the nervous system and the brain are pretty amazing. We just need to know
Mhm.
how to teach it more accuracy and how to teach it because it will do things based on our past experience.
Mm.
Whether that's childhood trauma
Right.
or pain,
Mhm.
like, it will do based on past experience. So if we can change and let it know what's going on in the here and now, it will be able to change. We call it neuroplasticity,
Mhm.
which that word kind of drives me nuts for lay people because I'm like, but plastic is hard. Like, it doesn't
Right.
make sense to me. I'm like, can we neuromalleable?
Right.
Ooh, I'm
Yeah.
making up a new word, people.
There we go. I
It's
like it. Do it.
neuromalleable
It
because
makes so much more sense.
neuroplastic
You're like,
is,
you can even just, like, comprehend that better. Like,
I
even just in your
know.
body, it feels better, right?
I
Just
feel
like,
like
"Oh,
me-
I can move." Right.
Medical
I think,
words, they like to complicate everything.
yeah,
So,
or make them like not be good for us.
yeah. Yes, very much so,
Right.
actually. Yeah, so we are very neuromalleable
Hmm.
and we are never too old to learn anything. We
Right.
just need someone to help us see where our blind spots are and meander those blind spots, basically.
Well, and I think it's also, I mean, I talk about nervous system regulation more now just through my own education. And I've got a couple, there's, one of my best friends, we talk about that stuff all the time. But outside of my girlfriend Amanda and I, for the most part, when I talk about nervous system, I get like are you a witch? Is it woo woo? What are you talking
Oh,
about? Is it real? Like, because we haven't, you say those
it's not
words and people
mainstream
go,
yet.
what? Like, what are you talking about? Is that because you go on
There's
retreats?
decades of research on this.
Right. But we
Decades,
don't
way
talk
more
about
than
it.
medical. No, we don't talk about. I think it's m- maybe changing,
Hmm.
but you're right. People still think, "Oh, so you're saying it's all in my head." I'm like, "You're actually, I will tell people right now, pain is 100% of the time determined by your brain and your nervous system, not your tissue."
Right.
It doesn't mean you're making it up. It's
Right.
taking your tissues into consideration.
Hmm.
So the inflammation, the chemical irritation, the
Hmm.
hormonal irritation that happens every month, it's considering that. But remember, some people with endo have no pain every month.
Hmm.
So it's like, what are these other confounding factors?
Hmm.
If the inflammation is high, that might be a contributing factor that that the brain is considering. We don't
Hmm.
have pain centers in our brain either. We have memory centers. Okay,
Hmm.
so if it's going based on in grade 6, I got my period at the same time that my we were moving, my parents were getting divorced, and I was bullied, your brain is going to associate that emotional distress with the first time you had a period, and every time you get a period, it's going to probably be associating those emotional distress. So we're complicated. Pain is complex, and
Hmm.
it's not easy to find someone, to be
Hmm.
honest, who
It's not.
understands pain neuroscience. And
No.
hopefully that changes. I remember when I first started, I had a mentor and I was like, "Hey, you are too smart. I need a for dummies version of this." And I almost like kind of had to step back and learn like from a patient point of view. No point,
Right.
no disrespect to
Yeah.
saying that we're dummies as the patient, but I mean
No.
from a layperson term
Yeah.
way, I had to learn it that way and then build up rather than reading like I literally have this $250 pain book right here
Right.
that when I first read it, I was like, "Oh my God, what?" And I could read it now and even still be like,
Mhm.
"Ugh."
What
But
is that?
I like to look at what's the research, but how does it apply to the people?
Right.
Like, I want to be the translator,
Right. Which is
right?
what we need. And
Yeah.
it's, just even you talking about, the like needing estrogen cream just, vaginally because it can help with all these things and just even to understand nervous system and pain. And if no one's talking about it or they either keep it this way up high or don't talk about it, like the extremes, it's this like that's what I love about you is like you're
Gap.
in
Yeah.
the middle trying to help the average person because the average person is the one who is dealing with the pain and isn't educated and we don't know
Yeah.
until we're in it, right? Like
Yeah.
we don't until we're experiencing it. Like it's really funny that you talk about the anxiety piece. Even I'm just thinking of myself, like I didn't even equate that, but I had ridiculous anxiety every month and I don't know why. Like I'm the in the, I'm going to the gym 3 times a week. I'm not having a period. I'm mentally in a really good place and state.
Yeah.
And yet I would have these moments where I'm like, I can't breathe.
Yeah.
And I
Yeah.
didn't even, if I think about it as I've been listening to, I'm like, it was monthly. It wasn't all the time, but that's crazy
And it
that,
might be what during months when there was a little more going on.
right.
And then it's like there's a little fuel on the fire, and then the luteal phase comes, the phase before your period, and then the fuel is like even more, and you're like
Right.
feeling it in your body as anxiety. And ironically, pain is an output when our nervous system thinks we're in danger. And it
Right.
doesn't care if it's endo giving you that input or
Right.
if it's a presentation you need to do that month or if it's a big move you did. So I maybe the take home message for people is to just be curious on the months that feel more calm and relaxed. Is that period better? And on the
Mm.
months that are a little more stressful, are those periods worse? Now I want to point out when I with this retraining of my nervous system, it got down to a point where I would get a period pain only on the months after I went away with my girlfriends. Now,
Mm.
if you had said, "Were you stressed this month?" I would say, "No, frig, I went on a vacation. It was amazing."
Right.
But so that's the thing about stress. It doesn't know the difference between stressors and good stress or bad stress. Like I
Right.
was up later. I was eating all sorts of things at
Right.
whatever hour. I was drinking sugary drinks. I
Right.
was, maybe not moving as much as normally would. Like
Right.
the fact that I was out of a routine when my nervous system was in training in and of itself can throw things off. So it
Right.
doesn't have to be bad stress. It could be stressors. So
Right.
look at your sleep, look at all that. I would say maybe as a take home message, if someone's feeling overwhelmed and feel they have like a lot going on and a lot of pain, produce a routine. Get up at
Mm.
the same time, go to bed at the same time, take sips of water throughout a day versus like glugs. Um, Get your movement in, and I don't give a shit what that movement looks like. It could
Mhm.
be like parking further away from your office and you're walking more steps that day. On the days where your nervous system is upregulated, maybe you're doing more stretching and more just a walk versus going to the gym and like
Right.
working out hardcore. That being said, if you need to get stuff out, get it out, but pay attention to when your nervous system is like, okay, thanks for getting that out. And rather than keep going, which
Mhm.
might be a message of like, oh, she's fighting something. Okay. And then it upregulates. As it lets go of that, like getting it out, then come work with it down. And then you're like, okay, I'm going to stretch now after just getting running on the treadmill or whatever.
Right.
Or if you're running outside, notice like, okay, I feel like I don't have to run anymore. And then maybe you start to walk. There's a lot of what I call interoceptive awareness. I try and teach people that
'Kay.
intuition, that
Mm.
like gut instinct with themselves to connect with that because it's very wise.
Yeah. Well, totally. And so if someone's listening and they're going like, "Yeah, that's all great, Amy and Jill, but like what is my nervous system? Like how do I even know if it's upregulated or downregulated? Like how do I know? Like how do I identify with my nervous system?"
Um, well, I'm trying to think if I have something online. I used to have a test that people could fill out. I do actually. If you're listening and you go on any of my posts
We can
on
link it too,
endo
Jill. We can link it in the show
okay,
notes.
on
Yeah.
endo together, if you put in missing, the word missing, or actually put in the word quiz. So
Okay.
put in the word quiz, and I asked like 4 questions that kind of give you a clue into whether your nervous system is a little bit upregulated.
Okay.
So it's like 4 questions, and then it'll direct you to a resource, whether you're yes or no.
Okay. I
But
love that.
there are, if you want to dive into it more, like you could, yeah, we can do an assessment or whatever. But
Yeah. No, but
yeah.
that's important. There's going to be people who are listening who are like, "Yes, I'm coming to your office and I want to learn this," because again, it's learning all the bits and pieces. Like I wish I knew. I mean, I'm so grateful for where we are. That's with a positive and a negative with women's health right now because we're actually
Mhm,
having these conversations. So
mhm.
we're on this catch up, but I'm looking at all my friends' daughters, and my like any younger female, I'm like,
Yeah.
this is a golden time for us. Um, because we're having these conversations now so we can help educate these young women who are behind
Yeah.
us, who are like, you are a complex human. Here are all the things you need to be doing. And it's not more and add it to our lives. It's like, these are the things that are going to allow us to live better.
Yeah. Yeah,
And that
I
is what
like to
I'm
call
so
them
excited.
opportunities.
Yeah.
They're opportunities, right?
Yeah.
To, like you said, improve your quality of life and work towards your goals so you're not constantly putting out the fire of
Mhm.
pain. Like it's just like every month, maybe I'm given a week or two of
Mhm.
feeling good and then it's the cycle all over again. And it's like, oh my gosh, that is not a way to live.
No, and just even carrying it, like, I've got friends you kn I didn't have another friend who had endo. I didn't have very many friends who even had painful
Yeah.
periods, so they'd watch me cry and hold me or pass me a glass of wine, like, whatever the case may be, or pick me up from surgery or do whatever, but just even, where we carry stuff and stress, and even on the side of, those of us who are caring for aging parents or children and all that
Mm.
things, like, our bodies are holding things. And to the nervous system conversation, that's everyone has a nervous system. Not
Yep.
everyone has endo. Not everyone even has a uterus anymore. Like, but we all have a nervous system.
Hmm.
And we're not necessarily taking care of that. And in taking care of that and taking care of ourselves, we can live better and possibly get rid of the pain in our right hip or our left shoulder,
Yeah.
right?
Yeah.
Because that's emotion.
Yeah.
And, again, some of my friends will look at me like I'm crazy, where, Amanda will be like, yeah, I'm carrying something. I just needed to leave my left hip. And I'm like, I get it. Where other people are like, is she crazy?
No, I
It's
mean,
like,
there's
it's real.
research on this. Yeah.
Yeah.
I mean,
It's
there's different
crazy.
contributing. I think the part that gets really confusing is when we have a disease that explains our pain. And I'm like,
Oh,
yes, and here are some other opportunities if if you're sensitive to all of the
right.
medications, that can be an indicator that your nervous system's sensitized.
Mm.
If you have pain that becomes non-cyclical, if it's like on one side and now it's on the other, or it started in your uterus and now you're getting back pain, or it's going down the leg. I've done a couple of posts on leg pain and endo, and
Mhm.
good Lord, does it go viral. It is a
Mm.
thing that people are getting confused about. So I've made a resource. I might even make a course about it because it's like, let's try and figure out, is it mechanical? Is it because of a nerve? Is it because of
Mm.
an organ? Like it can get confusing, right? Like if somebody came into me, I would be doing an assessment and then
Right.
assessing also their nervous system, like looking at all the contributing factors. But if I'm doing all this range of motion and I'm touching on the pudendal nerve in the pelvis, and they've been diagnosed with pudendal neuralgia by a doctor who didn't even do an internal, by the way, um, then I'm like, I can poke on your pudendal nerve and you're not screaming. I won't tell them what I'm doing
Right.
because I don't want to preemptively. But if I'm tapping on it, just so you know, I'm not like digging it,
Yeah.
um, and it's not reproducing anything, it's not the pudendal nerve. Let's look at something else. Let's look
Mm.
at whatever.
Right.
Anyway, I think, you wanna be able to look at all of the contributing factors and the spreading and all of that. The feet are next to the map of the body on the map
Mm.
of the body, on the brain, the feet are next to the genitals, so it's also not uncommon for people to have pelvic issues and then start to develop like plantar fasciitis or foot issues,
Mhm.
or vice versa. They could have foot issues for a long time and then start to develop pelvic issues. And
Interesting.
that needs to be retrained from a pain science standpoint rather than from a medical standpoint. So these are little hints that it might be more a neuroscience side of things than it is a physical side of things.
Right. I had plantar fasciitis and that just sucked.
It may
It
have been and now it's gone?
it's gone now.
When did it go? When your uterus was
Um,
out? I would be so
s
curious.
I actually got it probably a year after I had my hysterectomy.
Oh, you got ooh, that's interesting.
I got
Okay.
it I was probably a year out of my hysterectomy, and I started to gain weight, and I wasn't feeling well, and I wasn't on all my I left my hysterectomy. It was like, here's a bottle of estrogel. And I was like, okay. And there's so many other things I needed. And who knew until I discovered
Yeah.
it all on my own and found a doctor who would help me, who is, more of a Chinese medicine doctor,
Yeah.
holistic, whole, like
Great.
she can do
Yeah.
it all.
Yeah.
And I pay for her and I'm happy to. Dr. Huey has changed my life and allowed
Yeah.
me to be a part of my care. And that's been unreal. But I was probably a year out where I was like, I can't deal with this weight gain and what's happening. And so I started walking and I started weightlifting. And then I got plantar fasciitis. And I was like, great. So I started walking every day and now I can't move. It was so
How'd you get rid of it?
frustrating. I went to physio
Yeah.
and an
They worked on
osteo.
it.
Yeah, I did osteo and physio. And I found people who could tell me which shoes they wore when they have it. So I went back to wearing sneakers that worked and then I stayed off it and then it eventually
Yeah.
went away. But I didn't think that pain was ever it was so
Yeah.
painful.
And the hormone changes can affect our tendons too.
Mhm.
Like we might get frozen shoulder,
Yeah.
for example, or our it does affect our soft tissue as
Mhm.
well. So you could have had a component of that happening. And yeah.
Yeah,
Yeah.
I'd be
I
interested
mean,
to know how it would like when you just said they were connected, it was like, is that moving around my body? Is that,
well,
as it's like,
yeah. Who knows? I
yeah,
mean, I'd have to do an assessment, but it's
for
just
sure.
things to think about, right?
Right.
Like, mhm.
Okay, so before we talk about endo together, I do want to talk about the squatty potty because I think people go, what is that and why? And I think it's so important.
So, I mean, it doesn't need to be quote unquote the squatty potty. It can be a stool.
Right. Yeah.
But the idea behind it is that your feet are up on something when you're having a bowel movement
Hmm.
because our pelvic floor has a muscle, like I'm pointing down as if this is the rectum,
Yeah.
and then there's a muscle that puts a kink in the rectum when we're walking around called the puborectalis muscle. And so when we're walking around, it's so we don't shit our pants
Right.
or right? Like we need a
Just
little
kind of important.
resistance. Kind of important. But the invention of the toilet, especially if people are short and your knees are below, like if your feet are on the ground and your knees are below your hips, it can keep that muscle tight. And by like
Mm.
think about how we used to poop when we were back in cave
Squat.
when we would squat,
Right.
right? So by sitting on the toilet with our feet up, it's simulating that squat position, and what it does is puts that muscle on slack so that the rectum is more straight and has less resistance when we're having a bowel movement. That's why
Mm.
we do that. That's why we encourage it.
Right.
Yeah.
I'm not gonna lie, I use the garbage can at times, like, from the education and it was also from, like, living in pain and needing like, what
Yeah.
could I do to change this? And there was something like, I may not have known it in the beginning, but it was almost like if I could sit in the fetal position while I'm
You were
dealing with
trying
stuff,
to
like, I was trying to alleviate whatever
instinctually
I
do it.
possibly could do, and, yeah, it's
Well, based on what you're saying, also the other thing I encourage people to do is, if they pee first, wipe,
Mhm,
and then put toilet paper around their hand, and then support their perineum, which is the tissue in front of the rectum.
mhm,
Then that can help the pelvic floor feel more secure when you're having a bowel movement. So that's for people who
mm,
have painful bowel movements, which
okay.
also painful bowel movements isn't ha- Natasha Orr and her group out in BC, Canada showed that people who have pain system hypersensitivity or sensitivity, they're more at risk of having painful bowel movements because we always
Mm,
attribute those painful bowel movements with endo, and
mhm,
it's not always the case. It's not always the case. Could be
right,
both.
right,
Could be both.
right.
But splinting and supporting that perineum might be a way to help make those bowel movements feel a little more supported and a little less painful.
Mm, I love it.
We could talk poop all
Oh my
day.
god, I think that's a whole we could probably invite you back for that, and I'd be happy to
We should
talk
have a
about it
poop talk. Yeah.
because I think it's vitally important as well. Um,
Yeah.
talk to me about endo together because I think it's really important, the work you're doing.
So Endo Together is my personal account, and I have some free resources on there. And I'm going to be coming up with some ideas of short courses that might help people. Like, I'm talking like $67 or something,
Right.
something totally, but I know nobody has capacity anymore, but it's almost like would replace coming in to see, so people who
Mhm.
live and somewhere where they can't see a pelvic physio. I
Right.
want to kind of be able to reach
Help
the
people.
people that don't have the resources at hand to help
Right.
them, but make it feasible and all of that. So keep an eye out for that. And then we also have another I've started a program called Endometriosis 360.
Mm.
So that's on Instagram at
Okay.
endometriosis 360. And that's an interdisciplinary online program, group program. So not supportive, more educational,
Mhm.
with a dietitian, a psychologist, and myself. And then the medical director is Dr. Leonardi, who is an endo specialist in Hamilton.
Yes, I
So
wanna get
he's
him on the podcast. I've been watching him as well. Like,
yeah, he'd be great to have on the
yeah.
podcast. So he is the medical director, meaning he supports it, talks to it.
Okay.
Like he wants this to sort of become mainstream
Love it.
information, this interdisciplinary approach
Mhm.
that people take. Now, it's not funded by OHIP. I know we're gonna get a bunch of questions. There
Mhm.
is a program that Dr. Laura Katz, who is the psychologist on our team,
Mhm.
she started at Hamilton Hospital, at McMaster Hospital,
Mhm.
called the Pelvic Pain Program, and that is covered by OHIP.
Okay.
So people could go to that if they can't afford to pay out of pocket. But there's a wait list. So we were trying to
Okay.
provide something that could be like accessible to people
Right.
like right now. If people are in Ontario, they just need an assessment with us and then they can submit all of their receipts for their insurance.
Okay.
And then we are about to open worldwide though. So we're excited about that. The requirements are pretty much that you understand and speak English. So we're sort of targeting like North America and UK mostly
Right.
because of timing.
Right.
Australia will be behind because this is or no, they're ahead. But they're going to be
Yes.
sleeping at the time that we have most of our courses.
Right.
Mind you, they could get up and join us, but
Totally.
we might be thinking of something in the future to be able to reach more people that way. But
Yeah.
yeah, we're excited about that.
And I'm excited about this for others. And so and why did you decide to do this? Like how did you all come together to make this possible?
So I sort of stalked Dr. Leonardi when he first started.
I'm a big
I
stalker myself in terms of
I like
like,
to say we're
yeah,
resourceful.
I agreed, Jill.
I
Agreed.
mean,
Yeah.
it's a
You
fine line.
just yeah. Mhm.
But I sent him a message and I was like, I noticed you have a naturopath on your site for endometriosis. Why is there not a pelvic physio? And he's like, I think we should have a chat. And I was like, oh God. And then we had a Zoom chat. And then he would refer people because my clinic is sort of close to where he
Yeah.
works. And then he started to see people were starting to change, and he contacted me and said, "Can I come and shadow you?" And I was like, "What? Like, what
Amazing.
gynecologist does this?" Right? He really
So
cares.
great. I
Like,
love
he
that.
really, really, really
Mhm.
cares. If people are like thinking gynecologists don't really care, blah, 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 he really cares. And so he came and shadowed me. I was like, "Well, don't shadow, I'm a little bit different.
Right.
I look at things from a whole, if you want to see typical pelvic physio, maybe don't come see me." He's like, "I know you're different. That's why I want us to
That
come."
yeah.
And so we hung out, we had lunch together, and we just became friends. That was years ago. And then he contacted me, and Dr. Laura left she had young kids, so she wanted to leave and have more flexibility with her schedule. So
Yeah.
him and her were chatting, and then Emily, the dietitian, was chatting, and then they were like, "Hey, let's start something together because we're all speaking the same language
Mhm.
and we're all," and research is really strong in support of an interdisciplinary approach. And when I say interdisciplinary, I mean sometimes Emily will get credit for the stuff that I'm talking about, and we laugh because we don't really care. It's like, "Oh my gosh, what an honor for you to not even notice who's giving this information because the
Right.
information is so integrated." Because the
Mhm.
nervous system impacts the digestion for sure.
Huge.
What we eat impacts our pain, and that's
Mhm.
gonna impact what we're doing functionally, our movement and all of
Mhm.
that. And so it's all very integrated and people
I love
are
it.
connecting dots. So they may be seeing they've maybe seen a dietitian, they maybe seen a psychologist, they
Mhm.
maybe done CBT, they've maybe done physio, pelvic physio,
Mhm.
but no one is putting all of this together for them and
Mhm.
giving them strategies based on what they're figuring out with themselves. And the changes are incredible.
Oh,
It's amazing to witness and see.
I can
Yeah.
imagine. It's just when I was following what you were doing, and then I think I was following you before I even knew you knew Caitlin and Jana, and I've been following Dr.
Yep,
Leonard, right?
Leonardi. Yep.
Leonardi, and I was just, watching all of this going like, this is magic. Like what I wouldn't have given to have had people talking
Right?
about it, doing the work that you're doing now. I know how life-changing it's going to be for everyone that gets to see you, and just even for you to put it out there for the educators and the other doctors to see that it's possible, and it's working together is really the only way this puzzle is gonna get figured out, I believe.
Yeah.
And that's even where I come at it from the down there affair, and why I'm walking around in my underwear most of the time these days is because we
Love
need
that.
we need to fund it, right? Like, we can talk about it all we want, but research doesn't get funded by OHIP. Some of the kinds of care that doctors like you and your team are going out and doing isn't funded because it's not recognized yet. Although it's needed, it's not
You know
recognized
what
yet.
though? OHIP is not adding stuff on.
No.
Like they're taking stuff away. So that's probably never going to be covered, unfortunately.
Mhm.
I mean, there's potential for in sponsors and
Mhm.
funding and like, but it would be private funding and
Mhm.
like, so we almost need to think outside the box in
Yeah.
how to like sponsor a group
Mhm.
or so we are keeping that in mind. We do
Yeah.
know that not everybody can afford this and we don't love that. Like we would
No.
love to be able but groceries, like we have to
Mhm.
make a
Everybody
living
has to
too.
get
So
paid, right?
oh,
And
it's
that's
tough.
real. And
It's-
I mean,
yeah.
I made a decision that I was going to start paying people to help me, because some's covered, some isn't, because I knew I deserved a better life. And so it meant that there are certain things. I'm an entrepreneur, so times are good, times are bad, all that kind of stuff. But I was just like, but if I'm not well, I can't do anything. So I can have all the money in the bank or none of the money in the bank. But if I'm not okay,
It's
there's
an
nothing I
investment
can
in your
do.
health.
100%. And if
And
I
I
can
think
invest in a purse and a pair of shoes and a
I think
knickknack,
mhm,
I can.
something to consider.
Mhm.
I think you and I, like, in our season of life, we really start to appreciate our health a little bit more and
Mhm.
recognize we need to invest in it because it could be a slippery slope pretty fast,
Mhm.
right? When we're in our 20s, we don't think about that. But
No.
what I will say to the people in their 20s and 30s, fuck, you have a life to live.
Mhm.
Do not wait. Like, invest in yourself now. I'm sorry for
Mhm.
the F-bomb. Sorry,
I
not
use it all
sorry.
the time.
I can't I'm like, I know finances can be a thing for sure to
Yep.
consider. Absolutely. I don't want people to think that I'm like, don't worry
Yep.
about whether you're gonna eat or do this.
Right.
But I'm like, if you have goals and aspirations and want to live your life a certain way and you feel stuck, consider investing in yourself if you can,
Yeah.
because that shift may be everything in you then being able to travel or go to a friend's cottage or stop saying no to all the social events
Mhm.
that you're canceling at certain, even if it's just at certain times of the month. Our world becomes almost like smaller and smaller. So analyze whether you're making your world smaller and smaller because you're trying to stay comfortable. A big part of that is to, yes, work on the nervous system to desensitize it, but it doesn't end there. And I think that's where social media is like, do the walking, do the yoga, do the meditation. And you're like, fuck, I'm doing all that.
Yeah.
But work with someone who can help you build your window of tolerance back out towards your goals, towards
Yeah.
what you want to do in life. And that I feel like is the missing piece to the Instagram and to the the
Mhm.
the Facebook,
Right?
the interweb.
Exactly.
I'm dating
Yeah,
myself. I'm
it's
aging.
it's okay.
But you know what I mean? Like, to all the information, I mean, that's
Yeah,
out there is like, okay, calm the F down. Yeah, I know I need to do that, but that's only going to bring you into your window of tolerance. But
yeah.
if your goals and aspirations are outside of that, you need to work with somebody to show you how to expand back out there.
Agreed. Agreed.
Yeah.
I think we could talk forever and ever and ever, and chances are
Yeah.
you're 100% going to be back because we're likely going to talk about poop and maybe a whole bunch of other things.
Love it.
Um, but this has been amazing, and I am so grateful that you invested your time with me today and
Aw,
our listeners.
thank
Thank you
you.
so much. You are
Thank
very
you so
busy.
much.
You are very busy doing very important work that
Thank
is
you.
going to be life changing and
Thank you.
continues to be every day. And so thank you for that. I'm going to make sure that everything is linked in our show notes and so people can get a hold of you. But if someone wanted to reach out, what is the easiest way for someone to get a hold of you?
If they are on Instagram, I'm on
Hmm.
Instagram at Endo Together, as you mentioned.
Hmm.
If they're interested in the program, they can look at Endometriosis 360.
Hmm.
Um, we'll put the website information
Yep.
in the show notes, but you can send me a DM
Great.
or message me at Jill at HBPW, Healthy Balance Physiotherapy and Wellness .ca.
Okay. And we'll link
Yeah.
all of that because one, you're fun. So there's like the whole fun side of this healthcare side of things too,
I know,
because
everything's so
like,
blah, blah.
it
Like,
is, and
let's
when you're
lighten it up a
talking
little.
about the things that we're talking about and where you stick your fingers and the things we need to do and potties and all this stuff, like, just being able to disarm, because not only have we been taught to be in shame for a lot of the things that happen to our bodies and, with that shame and that embarrassment and is it only me, the fact that you create this openness about even just who you are, Jill, is phenomenal, and
Oh,
so
thank
thank you
you.
so much.
So honored to share it with you guys and your listeners. I love it.
Thank you. Thanks for getting loud with us today on the Down There Where podcast. If this conversation resonated with you, don't keep it to yourself. Share it with someone who needs to hear it. Subscribe so you never, ever miss an episode. And leave us a review. It would help us reach more women who've been told to suffer in silence. And here's the thing, awareness isn't enough. We need action, we need funding, we need change. That's where the Down There Affair comes in. We're a global peer-to-peer fundraising movement putting menstrual health center stage, from menstruation to menopause and everything in between. Diseases affecting men receive twice the funding of those affecting women. Only 11% of research dollars go to women's health. We're here to change that. Visit downtherewhere.org to register for our next walk, start fundraising, or join the movement. We can't do this alone. Oh, and follow us on social at The Down There Affair, because this conversation doesn't stop when the episode ends. Whether you're dealing with your own health journey, supporting someone who is, or ready to demand the care we all deserve, you're in the right place. Getting uncomfortable is where change happens, and we're never going back. I'm Amy Milne. Stay loud.
Oh, that was binge-worthy.